We will continue the previous lecture of food safety and defense. As you all know, food safety is a multidisciplinary scientific approach that emphasizes on reduction and prevention of foodborne illness by ensuring safe intake. Food safety is a chain of management starting from production to consumption of food. Food safety measures range from simple household preparatory operation to the molecular approach, being used to alleviate the arsenic in rice. Food safety measures not only are taken after the harvest of eatable commodities, these should be implemented right from the production premises to the final consumption. Food contamination is caused by biotic and abiotic factors. The abiotic and biotic factors may be pathogenic and non-pathogenic. Among the abiotic contamination, environmental contamination is causing raw food external contamination, transportation in non-sanitized containers, storage inappropriately, processing premises, packing material, soil, irrigation sources, animal dung is the major contributory at farm level contamination. Chemical contamination may also occur at farm level, non-voluntary chemical mixing with eatables. Pesticide bottles are washed with the irrigation water and produce is also washed by this contaminated water, hence make it unfit for human consumption. Large food production volume to feed the increasing population has increased microbiological infestation. Foodborne and waterborne contamination causing morbidity and mortality in infants. According to the WHO, waterborne diarrheal disease kills about 2.2 million people annually. Foodborne illness is a threat to developing countries. Mode of transmission has a wide range from physical to microbiological contamination. Among the microbial pathogenicity, Clostridium botulinum, Vibrio cholera, Salmonella typhi, Toxoplasma, Listeria monocytogenesis, which causes gastroenterocolitis in children. Foodborne contamination is a global threat, not only for developing countries where the sanitary and hygienic conditions are not up to the mark, facilitating its outbreaks. Comprehensive food safety measures are in need to be opted to restrict the economic burden. Food safety measures are imposing a $7 billion economic burden on the USA. The public health burden of Pakistan is increasing and imposing social as well as economic constraints. Total health care expenditure of Pakistan in 2000 to 2001 was 24 billion rupees, and in 2017 to 18 it has increased up to rupees 384 billion for the fiscal year 2017 to 18. The alarming increasing healthcare budget of Pakistan is imposing an extra economic burden. United Nations member states have to include 169 targets and 17 goals to frame their socio-economic policies. Sustainable Goals 3 and 6 are related to the health of people. This will be a milestone in decreasing the public health burden of Pakistan. Social behavior and activities of the people impart a major impact on food safety and food-borne illness. Safe feeding of the 9 billion population is a challenge in the present scenario. Epidemiological studies are also very important to evaluate the association between unsafe feeding, morbidity, and mortality. Developing countries have decreased the public health burden caused by unsafe intake by practicing appropriate measures. Food safety is not merely related to health but also has a potential social and economic impact.
Globalization and domestication are major contributory of food-borne contamination and illness. The mode of contamination varies from microorganisms to the physical substances which are being mixed up in foodstuff intentionally or non-intentionally. Contamination may be external or internal, where external contamination are caused by physical factors such as soil, water, air, dust, irrigation water, insecticides, rodents, or by different farm operations. Biological contamination is either pathogenic or non-pathogenic. Pathogenicity of microorganisms contaminating food varies from morbidity to mortality. Diversified food safety measures are needed to prevent foodborne illness because these organisms are well adapted with the environmental conditions, multiple host range, and rapid reproduction mechanism. Potential measures to control their pathogenic impact need adoption of proper sanitary and hygienic conditions, not only in processing premises but also in the production and consumption vicinities. Diarrhea and other systematic infections are caused by the Salmonella affect immune deficient infants and elder people. Salmonella affected about 80,000 to 4 million people annually. Eggs are the most prominent food infecting people. Campylobacter is intestinal infected bacteria. Pathogenicity may result in morbidity to mortality. Campylobacter jejuni and C. coli are foodborne infectious agent causes Guillain-Barré syndrome. Raw milk and untreated water is major carrier of these bacteria. Some physical extraneous substances which do not induce pathogenicity but are not safe to be ingested with foodstuff. Food containing these extraneous material, iron pieces, can cause injury by mechanical abrasion in gastrointestinal tract. Demonstrate representation of disease spreading in gut viruses arrive in human body through food, air with toxic resources. They settled down in intestine for controlling the metabolic activity of intestinal cells. Invasion or viruses in cells to control the genome of cell, by which viruses induce the cells to make abnormal protein to express the viral pathogenicity. Water, plants and animals are primary site for growth of bacteria, and many of them are useful in fermentation processing or medicine industry. But some are harmful for health and normal metabolism. About 400 species counted in gastrointestinal cavity or skin, such as Staphylococcus aureus, stat- settled on human skin or nasal cavity that produces toxins for causing infections. These harmful bacteria can be transmitted through contaminated food water inhalation, waste disposal of animal or birds. What are the prospects of Pakistan scenario about the foodborne illnesses? Foodborne illnesses are mainly due to the ingestion of microbial contaminated food and other toxic and contact foods by which all over the world these types of diseases are common, neither climate dependent nor region dependent. Hepatitis, typhoid, animal contact disease, influenza, along with soil contact disease, are common in Pakistan. Unhygienic conditions, absence of proper food standards, poor sanitation, poverty, and illiteracy are major causes in spreading of foodborne diseases. You can see here in a graphical demonstration which depicts the percentage of species-specific foodborne illness in Pakistan. The estimation of different foodborne diseases is dependent on pathogens which contaminated food items. The outcomes of exposure to foodborne diarrheal pathogens depends on several host factors, including pre-existing immunity, the ability to elicit an immune response, nutrition, age, and non-specific host factors. As a result, the incidence, the severity, and the lethality of foodborne diarrhea is much higher in some particular vulnerable segments of the population, including children under 5 years of age, pregnant women, immunocompromised people, and the elderly. In Pakistan, there are many bases for microbial diseases, like poor packaging of edible items, the occurrence of Campylobacter in different food items, like meat and milk in Pakistan. By testing the meat sample, the highest prevalence, 48% of Campylobacter, was observed in raw chicken. That in raw beef, the percentage is about 10 to 9%, and in raw mutton, the percentage is 5.1%. In other foodstuff, vegetables, fruit salad, it's about 40.9%. Sandwiches, 32%, cheese, 11%, and raw milk bulk samples represents 10.2%, exhibiting the leading rates. Water is the basic necessity and required to sustain life. The importance of water has been revealed in Holy Quran. Life has been created with water. Contaminated water is outbreaking gastrointestinal as well as chronic liver disease. The situation is more miserable in the urban population rather than the rural population. Water is being contaminated by various environmental and biological factors. Water horizons below the soil is being polluted by synthetic fertilizers, pesticides, and herbicides. Intake of contaminated water is causing foodborne illness. Among the foodborne illness, diarrheal problem is the overwhelming and major contributor of infants mortality. E. coli, Citrobacter, Enterobacter, and Klebsiella species are the major contaminator of water. Among bacteria, in Pakistan, only 20% population has access to safe drinking water. Waterborne disease contributing to 80% of all disease and 30% of all deaths. Water is the basic necessity, as you all know, and required to sustain the life. Globalization and urbanization have increased the food demand for the population. Ensuring the population health extensively needs food safety measures. Street vendors involved in the eatable business and household have to be focused to create mass awareness of the food chain, foodborne contamination, ways to prevent and reduce the instant food contamination, sanitation, and hygienic conditions. Globally, food safety has got attention in Uruguay around 1995 during the International Trade Conference. Food regulations and standards are being observed throughout the production processing and consumption chain to ensure food safety. Punjab province has taken the initiative taking into consideration of food safety importance formulated Punjab Food Authority Act 2011, which has been followed by KPK in 2014. Two provinces of Pakistan have an organization for the standardization and regulation of food standards. Punjab Pure Food Rules cover about 104 food items with 9 broader categories. Food safety is not only a national need now, international trade prerequisite. The food safety measures for the export of the food items, either raw or processed. ISO, which is the International Organization for Standardization, is an international standard setting body. Its headquartered in Geneva, Switzerland, with 162 member countries. USA, EU and the majority of the Gulf countries allow the import and export of eatables if have the food safety certification. The government of Pakistan has adopted 2070 International Organization for Standards and developed 8,857 Pakistan standards. Food standards are aligned with Codex Alimentarius Commission and traceable with WHO. The food safety technologies and policies. Production change of unit of fruits and vegetables should be critically evaluated by considering the source of infection. No innovative antimicrobial chemical available that could be applied effectively and efficiently to remove pathogenic microbes. Contamination at production can multiply the microbial load, could increase its pathogenicity. Washing of fruit and vegetables at production site in running water can effectively reduce its pathogenic load and make it safer for human consumption. This infection could also reduce the microbial up to the extent to make farm produce more safe and healthy. Government and food safety regulatory organizations should provide resources and technical guidance to the producer to make their produce safe. Processing premises should opt appropriate location and design, equipment design, pest control, waste management, sanitary measures, personal hygiene, appropriate handling, packaging and storage, and training of staff to ensure end product safety. Food safety can ensured by proper food processing operations, including use of food additives, food preservatives, flavoring, antioxidants, antimicrobial agents to ensure the quality and safety of processed food. Following are the organizations involved in the food safety certification. The following certification agencies should address the food safety issues at grassroots level. Being developing country, our food business is predominantly run by the street vendors. Comprehensive action plan is needed to address the food vendors regarding their knowledge about safe food, its handling and health hazards for using unsafe food. SGS Pakistan Private Limited Systems and Service Certification supporting an organization's aim and objectives and ISO 9001, ISO 22000 QMS documents the process, procedures, and responsibilities for achieving quality policies and objectives. Based on 8 quality management principles, the ISO 9001 2015 standard defines the way an organization operates to meet the requirement of its customers and stakeholders, including customer focusing, leadership, and involvement of people, process approach, organizational context, continual improvement, fact-based decision making, and risk-based thinking. Bureau Veritas certification (BV) certification enable organizations compete in the global food and beverages industry. Players must demonstrate that their products, processes, and services meet the highest levels of safety, quality, and responsibility while keeping up with evolving trends and market demands. Whether you are a food manufacturer, processor, importer, supplier, or retailer, stringent industry and regulatory standards and complex globalized supply chains are making this an increasingly challenging task. Certification Services Pakistan, in a conformity assessment body established to provide certification, training, and inspection services as per requirements of national and international standards like quality management system, environment management system, occupational health and safety management system. Food Safety Management System, and Information Security Management System, Halal Food Management System, Personal Certification, Product Certification, Inspection Services, or any other field of certifications emerging from time to time. Certification Services Pakistan team includes qualified and competent management system auditors, trainers, and support staff committed to provide professionals and value-added services to its customers. Provisional food authorities entrust the following functions and responsibilities to regulate and monitors the food businesses in order to ensure compliances by farmers, manufacturers, distributors, importers, and other stakeholders. In order to provide safe food, formulate standards, procedures, processes, and guidelines in relation to say any aspect of food, including food businesses, food labeling, food additives, and specify appropriate enforcement systems. Enforcement of food safety and quality standards, specify procedures and guidelines for setting up and upgradation of food laboratories, specify licensing, prohibition orders, recall procedures, improvement notices, and prosecution in the court of law, provides scientific advice and technical support to the government in matters relating to food safety. Establishment of food laboratories, organize training programs in food safety and standards, promote journal awareness regarding food safety and standards, certify food products for export, forward and backward traceability of food items and surveillance, including collection, integration analysis, interpretation, and dissemination of data related to food and nutrient intakes. Total healthcare expenditure of Pakistan in 2000 to 2001 was 24.28 billion rupees, and in 2017 to 18 it has increased up to rupees 384.57 billion for the fiscal year 2017 to 18. United Nations Industrial Development Organization, together with the Project for Agri-Food and Agro-Industry Development Assistance for Pakistan, project partners celebrate the World Food Safety Day to achieve improved health outcomes and sustainable development in country. On 7th June 2022 in Islamabad, the United Nations Industrial Development Organization, together with all its public and private partners, under the Project for Agri-Food and Agro-Industry Development Assistance in Pakistan, celebrated World Food Safety Day to encourage healthy food practices, to increase the sustainable production and consumption of safe foods to improve health outcomes. The United Nations General Assembly established World Food Safety Day in 2018 to raise awareness of this important issue. WHO announced the theme for this year's World Food Safety Day, which is the Safer Food and Better Health. UNIDO joins the World Food Safety Day campaign to ensure safe food for all. The celebration took place as a part of the Project for Agri-Food and Agro-Industry Development Assistance, specialized training on the good hygiene practices and good animal husbandry practices in Islamabad. UNIDO's country's representatives of the Ministry of National Food Security and Research, public and private partners from the KP province including KP Food Safety and Halal Food Authority, Directorate of Livestock Research and Development KP and local council board were part of the event. Opening the World Food Safety Day celebration, UNIDO country representative said food producers need to adopt good practices and must make sure that the food is safe. Improved food safety contributes to food security and lowers malnutrition, which ultimately reduces the burden on public health infrastructure. She also appreciated the government of Japan and the Japan International Cooperation Agency for funding PAFET and the MNSFR, the public and private counterparts in Khyber Pakhtunkhwa and Balochistan provinces for their continuous support for the effective implementation of PAFET and ensuring food safety and food security in the country. Representative Jika stressed on the importance of food safety and further appreciated both the public and private stakeholders on raising awareness on World Food Safety Day. Speaking at the occasion, National Veterinary Laboratory MNSFR said agriculture is a priority area for the government of Pakistan to ensure food security for all segments of the society. He added, food safety is inevitable to prevent foodborne illnesses and helps reduce the burden on public health infrastructure and for your products to reach export markets. I would like to appreciate the work UNIDO is doing and the hard work all the departments are carrying out on the ground on daily basis to ensure the public has access to safe food. The representatives of LDD and the LCB also shared their remarks on food safety at the occasion. Lead National Project Coordinator Paffett shared the achievements of the project and highlighted the contributions of UNIDO and its public and private partners in food safety. The event concluded with the screening of a video in recognition of World Food Safety Day. Trafford is a 4-year Japan International Cooperation Agency funded project being implemented by UNIDO in close coordination with the Government of Pakistan aims at improved pilot applications of the compliances, capacities and value addition practices in the cattle meat value chain in Khyber Pakhtunkhwa province and apple value chain in Balochistan province. The Department of Food Sciences and Human Nutrition of the University of Veterinary and Animal Sciences, Lahore, in collaboration with Punjab Food Authority and Nutrition International arranged a national seminar to mark World Food Safety Day with the theme of Safer Food, Better Health, to promote awareness on the importance of food safety and highlighted key steps being undertaken to control the risks of foodborne diseases among public and students here in the city campus. Vice Chancellor and Director General, Punjab Food Authority, co-chaired the seminar, while Chairman Department of Food Sciences from public and private sectors, various organizations, faculty members, and a large number of students attended the seminar. Speaking on the occasions, Pakistan is the fourth largest producer of milk in the world, and the Punjab Food Authority is confiscating a large quantity of adulterated milk and discarding this across the province on daily basis. He also shared that the authority is working with industry and consumers to promote the culture of food safety by preventing the sale of adulterated, unsafe, and loose food in the market. He also said that it was a positive contribution and an indication that the government is giving due importance to food safety. He also said a good knowledge of food safety helps the masses to prevent and detect illness that is usually caused by consumption of unsafe food. It is the responsibility of every consumer, food handler, and regulator to contribute in addressing food safety issues. Bioterrorism. Food terrorism is an act or threat of deliberate contamination of food for human consumption, including animal used for food with chemical, biological, or radioactive agents for the purpose of causing injury or death to civilian population or disrupting social, economic, or political stability. Terrorists could attack livestock, crops, or processed food at any stage of the food supply: production, processing, harvesting, storage, manufacturing, transport, storage, distribution, or services. Agroterrorism targets livestock and crops during the food cycle, deliberately introducing disease intended to generate fear, cause economic losses, or undermine stability, with annual revenues of approximately $1,000 million. The US livestock industry is a likely target for economic warfare. The term syndromic surveillance applies to the surveillance using health-related data that precede diagnosis and signal a sufficient probability of a case or an outbreak to warrant further public health responses. Through historically, syndromic surveillance has been utilized to target investigation of potential cases. Its utility for detecting outbreaks associated with bioterrorism is increasingly being explored by public health officials, whereas we are experienced in dealing with unintentional foodborne illness outbreaks and their impact on public health. We do not have actual data on the extent and impact from a terrorist event could have. Epidemiologists have attempted to extrapolate what the impact could be based on the data from foodborne illness outbreaks. Is the threat of a terrorist event that compromises our food supply real or exaggerated? The FDA has concluded that there is a possibility for a terrorist event that might affect a large population of people. The only documented case of food terrorism designed to achieve political goals originated when members of a communal religious sect in Oregon contaminated salad bars with salmonella to prevent local residents from voting on a ballot proposition to, to which the group objected. The two other incidents involving intentional food poisonings were not motivated by political ideology. In 2003, a supermarket worker was charged with intentionally contaminating 200 pounds of meat with a nicotine-containing insecticide. And in 1997, a laboratory worker intentionally contaminated his co-workers' pastries with a strain of Shigella. No deaths occurred. Not all public health practitioners considered widespread food terrorism a realistic scenario. What is the disaster life cycle? Which include response, recovery, mitigation, prevention, and preparedness. Response activities address the short-term direct effects of an incident. Response includes immediate actions to save lives, protect property, and meet the basic human needs such as food, water, clothing, and shelter. Response may also include activating a public warning, instituting a curfew, executing emergency operations plan, such as mobilizing emergency and security personnel and equipment, and generally undertaking incident mitigation activities designed to limit the loss of life, personal injury, property damage, and other unfavorable outcomes. And recovery include basically recovery is the process of returning to normal. Salvage, resumptions of business process, and repair are typical recovery tasks. It includes the development, coordination, and execution of service and site restoration plans for affected communities, and the resumption of government operations and services through individual, private sector, non-governmental and public assistance programs that identify needs and define resources, providing housing and promoting restoration, addressing long-term care and treatment of affected individuals, incorporating mitigation measures and techniques, evaluating the incident for lessons learned, and developing initiatives to mitigate the effects of future incidents. Recovery activities might also involve returning vital life support system to minimum operating standards, damage insurance, loans and grants, temporary housing, disaster unemployment insurance, public information, health and safety education, reconstruction, counseling programs, and economic impact studies. And mitigation is the sustained action that reduces or eliminate long-term risk to people and property from natural hazards and their effects. Mitigation activities eliminate or reduce the probability of occurrence of a disaster or reduce the effects of unavoidable disasters. Mitigation measures include building codes, vulnerability analysis updates, tax incentives and disincentives, zoning and land use management. Building use regulations and safety codes, allocations, and interstate sharing of resources, preventive healthcare, and public education. Information resources and service important in mitigation activities include geographic information system, based risk assessment, claims history, facility or resource identification, land use or zoning, and building code information. Use of modeling or prediction tools for trend and risk analysis is also important. Prevention encompasses the action taken to avoid an incident or to intervene to stop an incident from occurring in order to protect lives and property. Preparedness is the range of deliberate, continuous critical tasks and activities necessary to build, sustain, and improve the ability to prevent, protect against, respond to, and recover from domestic incidents. Government agencies at all levels have an obligation to prepare themselves and the public for emergencies. Community groups, service providers, businesses, and civic and volunteer groups are all partners in this effort, as everyone needs to be prepared. During this phase, responsible parties develop plans to save lives, minimize disaster damage, and enhance disaster response operations. Include plans, emergency exercises or trainings, warning systems, emergency communication system, evacuation plans, and training. Resource inventories, emergency personnel or contact list, mutual aid agreements, and public information or education. Responding to a disaster is a complex multi-pronged effort. Depending on the nature of the disaster, responders provide basics such as food, water, and shelter, as well as medical care for both acute and chronic conditions, security services, and damage control. An effective response demands advanced planning and a high level of organization. The three emergency support function areas in which food and water are most heavily involved include mass care, housing and human services, public health and medical services, and agricultural and natural resources. Each of these areas is a grouping of government and certain private sector capabilities into an organization structure to provide the support resources, program implementation, and services most likely to be needed to save lives, protect property and the environment, restore essential services and critical infrastructure, and help victims and communities return to normal when feasible. Following the domestic incidents, Pakistan has a strong disaster management foundation built around the National Disaster Management Authority. The provisional disaster management authorities and national legislation from 2010. The government has well-established national development and disaster risk reduction frameworks, including the Pakistan Vision 2025, the National Disaster Management Plan 2012 to 2022, and National Flood Protection Plan. Humanitarian partners also work across different areas to ensure alignment of response with government activities. The United Nations and humanitarians work closely with NDMA, PDMA, line ministries, and the National Disaster Risk Management Fund in support of these initiatives. The Government of Pakistan, with support from international and national humanitarian and development partners, responded to the pandemic by strengthening response coordination, case management, disease surveillance, and testing services in laboratories, health system, and community mobilization to brace for the impact of COVID-19. The United Nations is working with the federal and provincial governments at multiple levels to aid coordinated management of COVID-19 preparedness and response. Through the coordination mechanisms, the United Nations Office for the Coordination of Humanitarian Affairs has supported the humanitarian coordinators and humanitarian team by implementing the global humanitarian response plan, including supporting coordination structure at national and provincial level through working groups with NDMA, PDMAs and relevant ministries and line departments. Several agencies including the World Bank, World Food Programme, the United Nations High Commissioner for Refugees, United Nations Population Fund, the Food and Agriculture Organization of the United Nations, United Nations Children's Fund, United Nations Women and others has coordinated in the country to achieve all these goals and lessens the burden. For example, UNICEF has focused its water, sanitation, and hygiene response and capacity building support by concentrating WASH, infection prevention and control intervention in 20 of 27 high burden districts. This activity including drafting the National WASH IPC COVID-19 Preparedness and Response Plan. Almost 9 million people in the country have been supported with hygiene promotion service including COVID-19 prevention and control information, with close to 5 million people utilizing the additional hand washing stations in affected areas.